Good afternoon, group. My name is Arianet Martel Rodriguez, and I'm part of the group 9. We went for an article that basically talks about the management of the treatment of the regenerative medicine for chronic pains, specific in neck chronic pain and low back pain. The part that was assigned to do was the introduction and the literature review. The introduction and a little resume will go by this, and then I will talk about the literature review. The introduction, I tried to resume it as best as I could, and I tried to do my best job. I really hope it is well done and you guys can understand our job and my job. The introduction will go by this. The management of growth of the chronic pains, such as the neck pain and back pains, have many modalities, and it can be placed in a growing scale at a high level. The chronic neck pain and the low back pain have shown a negative impact in the healthcare area, specifically within the workers and also in the public healthcare area, but mainly within the workers in United States. Many studies have demonstrated the amount of money that we spend and that United States spend in the management, the treatment, and the research of chronic pains. The neck and the low back pain has a pretty high prevalence. On this study, from 1996 to 2013, there is an approximation on the $57 billion that the government had to spend on it. Also, those conditions, along with the prevalence, as I said before, and the society, has helped to increase the burden and the socioeconomic burden with the highest cost in United States. The literature review and a resume will go by this now. The literature review of this article, they basically worked with 4 articles, with 4 systematic review articles, but they also used 7 more that demonstrate the stem cells use and that demonstrate how to work with animals and the research with animals and humans, and the outcome and the help that was given to the management and treatment of the chronic pains. There are a few researchers and a few developers of those theories. There is Mr. One, who did study the efficacy of intervertebral disc regeneration using the stem cells in the systematic review and the meta-analysis of controlled animal trials. There is also Mr. LaPrade, that he discussed the evidence of supporting the potential use of biologic for the promotion of the healing and functions in patients with musculoskeletal injuries. There's another researcher, Mr. Wood, who conducted the systematic review in a single-arm meta-analysis of 6 reports and on a cell-based therapist for the lumbar discogenic pain, and conducted that these therapies were associated with improvement in pain and disability scores. And a little resume that was it. That was our work together. We were back and forth. I'm very thankful for the group I got. We were working together very closely, believe it or not. We were talking each others and calling each other, and we did I consider a really good work and group. And I hope you guys like it, and you professor think it's a good work, and we did good job as a group, and we really met your expectations for this group assignment. Thank you so much, and it was a pleasure to be one of your students in this class. I really appreciate your presence every day and all your tips and all the good instruction that you.
Hello everyone, my name is Romajan and I am one of the members from Group 9. For this group presentation, we chose an article titled "Do Regenerative Medicine Therapies Provide Long-Term Relief in Chronic Low Back Pain? A Systematic Review and Meta-Analysis." So for this presentation, I was responsible for completing the research method. So for this study, a meta-analysis method was used to synthesize different results found among several studies. First, the researcher accessed a virtual library through the MRU homepage. Second, accessed the EBSCOhost databases. Third, selected both Medline Complete and CNAL Complete. Then performed an advanced search for which the following keywords were entered in the Boolean search: regenerative medicine, chronic, and back pain. Search was limited to references providing full text, peer-reviewed, and abstract available. Limitation was set for research published within the last 5 years, from 2016 to 2021. Researcher consulted only articles published in English. The search provided access to a total of 39 articles, and only 5 studies were selected based on the relevance with the topic, and 34 were discarded.
Hi everybody, my name is Aaliyah Martinez, part of Group 9. Today I'm just going to be talking a little bit about my sections in the chronic lower back pain. So there have been a couple of things that have helped relieve lower back pain that they were trying to study. So some conservative modalities include PRPs, which are plasma-rich plasmas, MSCs, epidural injections, lumbar facet joint injections, and sacroiliac joint injections. There were about 12 studies that showed significant improvement in pain relief and functional status while demonstrating limited improvements in promoting regeneration and the reversal of the degenerative processes. MSCs actually demonstrated a significant reversal of disc degeneration with a better quality of repair compared to the non-MSCs treatments. So some conservative treatments based on physical therapy, injection therapy, or intradiscal therapies do not reverse the degenerative process. Conservative treatments offer the possibility of preventing or inhibiting degenerative changes, and they may represent a better treatment alternative. There have been only 21 studies that met the researchers' inclusion criteria. Most of the studies were observational, and there were a small amount of patients used. So there's a lack of valid or reliable selection criteria for the patients with the pain, but more studies are necessary to better understand the role of MSCs and PRP in bringing about beneficial effects in lower back-related pain. So in conclusion, the findings demonstrate that MSCs and PRP may be effective in managing discogenic low back pain, radicular pain, facet joint pain, and sacroiliac joint pain with variable levels of evidence. That sums up our PowerPoint. I hope you enjoyed, and thank you for watching.